Hey everyone. For the Capstone Project Part 2, Analysis of Social Policies, Research and Advocacy Connected to Interventions and Evaluation, I will be discussing how social policies, research, and advocacy inform social work practice, specifically in addressing substance use disorder. The organization focus will be on my practicum setting from last semester, Nova Transformations. I will walk through how interventions work across multiple levels, from individuals to organizations, and how social workers play a role in promoting equity and justice in the treatment setting. Social problem overview. The primary issue I am focusing on is stigma and discrimination toward individuals with substance use disorder. This stigma is often rooted in misinformation and moral judgment, which leads to serious consequences. People may avoid seeking treatment, will likely receive a lower quality of care, and face a higher risk of overdose. According to a research study conducted by the CDC in 2024, only 13 million out of 54.6 million people needing treatment for substance use disorder actually received it. This proves how stigma acts as a major barrier to care. Practice-informed perspective. From a practice-informed perspective, clients often experience feelings of shame, guilt, and fear related to their substance use. These feelings can make them hesitant to disclose important information, especially if they anticipate judgment. As a result, treatment is often delayed and engagement is low even after entering services. For example, clients may avoid being fully honest about their substance use, which can directly impact the effectiveness of interventions. Research-informed understanding. Research supports what we see in practice. Stigma leads to poor health outcomes and creates barriers to housing and employment. It also disproportionately affects marginalized populations, including Black, Indigenous, and people of color, and LGBTQ communities. These disparities highlight how stigma is not just an individual issue, but a systemic one that reinforces inequality and limits access to resources. Stigma can prevent individuals from seeking or continuing treatment. Relevant social policies. Several policies aim to address these issues. The Mental Health Parity and Addiction Equity Act ensures that insurance coverage for substance use treatment use is comparable to physical health coverage. The Drug Addiction Treatment Act expands access to medication-assisted treatment. While these policies are important, gaps in implementation still limit their effectiveness, especially for underserved populations. Human rights and social justice. Substance use disorder should be understood as a public health issue, not a moral failing. When individuals are denied access to care due to stigma, it becomes a human rights issue. These barriers reflect broader systemic inequities tied to race, class, and access to healthcare. As social workers, it is our role to advocate for dignity, equity, and access to treatment. According to the National Institute on Drug Abuse, addiction is a chronic, treatable disease, not a moral failing. Evidence-based interventions at the individual level. At the individual level, evidence-based interventions include person-first language, trauma-informed care, motivational interviewing, and medication-assisted treatment. These approaches help reduce stigma, build trust, and support recovery. Motivational interviewing, in particular, empowers clients to explore change in a non-judgmental way. Evidence-based interventions at the family level. Family-level interventions focused on improving relationships and addressing patterns that may contribute to substance use. This includes family therapy, education, and support groups. These approaches can also address generational trauma and improve communication within the family system, which is critical for long-term recovery. Evidence-based interventions at the community level. At the community level, interventions focus on education, awareness, and harm reduction. For example, overdose awareness events help reduce stigma and increase knowledge about prevention. Community efforts play a key role in shifting public perception and creating supportive environments for recovery. August is Overdose Awareness Month, and August 31st is recognized as National Overdose Awareness Day. At my practicum setting, an overdose awareness event was held on a weekend in August in Charlotte, bringing individuals in recovery, those advocating for change, and those grieving the loss of a loved one to get together to raise awareness. After the event, a process group was held the next day for our clients, where they were given purple ribbons to write the names of individuals they know that died by overdose. We also had a purple balloon release to honor those individuals. This was a great way to bring awareness to the cause and bring everyone together to grieve and support one another. Evidence-based interventions at the organizational level. Organizations play a major role in shaping outcomes. Evidence-based practices include trauma-informed systems, cultural responsiveness, staff training, and access to medication-assisted treatment. Research shows that these approaches improve retention and reduce stigma. Organizations that prioritize these practices are better equipped to meet the needs of diverse populations. Research regarding medication-assisted treatment has proven to increase patient survival rates, increase treatment retention rates, decrease criminal activity related to opioid use and other drug use, and increase patients' abilities to gain or maintain employment. Despite this evidence, stigma and policy barriers still limit access, which highlights the need for continued advocacy. Organization evaluation. Evaluation is essential to determine whether interventions are effective. Key indicators include retention rates, relapse rates, client feedback, and reassessments. Using data-driven approaches allows organizations to continuously improve services and ensure they are meeting client needs. Research has shown that retention, engagement, and relapse rates are key indicators of treatment effectiveness. Leadership in transformative practice. Leadership plays a critical role in driving change within organizations. This includes promoting staff training, fostering community engagement, and creating a person-first culture. Transformative practice happens when leadership supports evidence-based approaches and encourages continuous learning. The importance of ongoing staff training leads to the following: comprehensive knowledge, evidence-based practices, effective communication and therapeutic relationships, cultural competency and sensitivity, crisis intervention and de-escalation techniques, and lastly, safety and emergency protocols. Organizational policies and inequities. Despite progress, some organizational policies still contribute to inequities. For example, reliance on private pay and regulatory barriers can limit access to treatment. Research shows disparities in treatment completion rates across racial groups, which highlights ongoing systemic inequality. A research study found that white participants had the highest completion rate of 50%, while the Hispanic population was at 47%, and African American participants were significantly lower at only 40% completion. Group work in my practicum setting. Evidence-based group interventions include cognitive behavioral therapy groups and psychoeducation. These approaches help individuals challenge negative beliefs and develop coping skills. Evaluation methods include tracking, engagement, participation, and feedback. The Center for Substance Abuse Treatment highlights 5 group therapy models: psychoeducational groups, skills development groups, cognitive behavioral and problem-solving groups, support groups, and interpersonal process groups. Process groups create a safe space for exploring emotions, experiences, and personal growth. Therapy groups create a safe space for shared experiences. Lastly, peer support specialists serve as a mentor that share experiences in hopes of inspiring hope, reducing stigma, and helping others identify their strengths. Evidence-based interventions and evaluation at the group level. Evidence-based group interventions include cognitive behavioral therapy groups and psychoeducation. These approaches help individuals challenge negative beliefs and develop coping skills. Evaluation methods include tracking engagement, participation, and feedback. CBT groups are often used early in recovery. Cognitive processes include different psychosocial elements like thoughts, beliefs, decisions, opinions, and assumptions. Common beliefs of individuals entering treatment include thinking that they are a failure, that they are different, that they are not strong enough to quit, that they are unlovable, and that they are morally a bad person. Advocacy through groups. Groups also serve as a platform for advocacy. They empower individuals to share their experiences, reduce stigma, and raise awareness. Lived experiences are powerful tools for influencing change and addressing systemic barriers. Advocacy through groups also looks like empowering voices, reducing stigma and shame, and promoting awareness. Lived experiences are a powerful advocacy tool that can address systemic barriers, improve coping skills, and enhance self-efficacy. Advocacy strategies. Advocacy happens at multiple levels of social work. At the micro level, it looks like using person-first language. At the meso level, we influence organizational culture. At the macro level, we advocate for policy changes that improve access to care. Social workers play a key role across all levels. Social workers also make an impact working with individuals that have substance use disorder by conducting psychosocial assessments, reviewing individual needs of each client and creating individualized treatment plans, assessing for generational trauma, and staying well informed through ongoing training. Promoting social justice. Promoting social justice means expanding access to care, improving cultural responsiveness, and advocating for policy reform. When equity is prioritized, outcomes improve for individuals and communities. Key takeaways. To summarize, stigma remains a major barrier to treatment. Research and practice must work together to inform effective interventions. Social workers are uniquely positioned to advocate for change and promote equity across systems. Competency connection. This presentation connects to several core social work competencies, including research, policy, intervention, and evaluation. These competencies guide our work and ensure that we are providing ethical, evidence-based care. These are my references. Continue.